appreciate you telling the readers of Mommy Be Knows Best a little bit more about anaphylaxis and your experience. And I know you're so inspiring to families. And I'd love for you to share a little bit about your story and how you found out you had severe allergies and how you're dealing with that now.
Absolutely. So for me, it's very personal to team together with Mylan Specialty in bringing through this campaign an awareness that families across America are more prepared, who may not know they're at risk, or those that do know that they're at risk and challenged every day. It's personal for me because we do know that food allergies are on the rise across America, and also this is a really serious health issue. Anaphylaxis is a life-threatening allergy. It's certainly one that I, by accident, realised at the age of 4, coming together with the family and my mother cooking shrimp, and she gave me some, and I went into my anaphylaxis, and the signs and symptoms for me certainly were hives and swelling, and my throat itching and starting to close up. And straight away, as somebody who does have allergens to dander and to certain flowers, my parents were aware that this certainly wasn't that kind of an allergy. And so I was rushed to hospital, where I was given epinephrine, and from then on I learnt to use my EpiPen auto-injector. So for me, this is incredibly important for adults as well as children and families really here in America to understand the importance of being prepared. And so I have a 3-step action plan that I use, which is certainly being very diligent in avoiding all those triggers. Knowing the signs and symptoms for me is incredibly important, and to administer if necessary. I carry my 2 EpiPens with me absolutely everywhere. I have them in my hand as we talk. You can see them here, because it's so important for me, especially when I'm traveling and helping families. So those young children who love peanut butter jelly sandwiches aren't able to have those when I'm helping them, but they've got used to it now. And of course, the 3rd step is always to make sure that you call the emergency Medicare, because, you know, using your EpiPen to administer when you are having these signs and symptoms is important. And I think really what we want to be able to understand is how we can be prepared so that we can really eliminate all those common misconceptions. Can we travel? Can we do the little things that we desire to do in life? Is it okay for our children to go to birthday parties? Will we be safe if we go to an office party and enjoy ourselves in, you know, our family or friends' company? And so for me, this is incredibly important to be able to do so. But I'll defer to Dr. Martha White, as she'll be able to explain to you more in detail what those signs and symptoms are.
Yeah, thank you. So the most common signs and symptoms of allergic reaction start with the skin. For most individuals, you'll get flushing or redness of the skin, hives, which is an itchy welt type reaction, shortness of breath, maybe an itching in the mouth, tightness in the throat, and then a lightheadedness, a feeling like you're maybe going to faint, and oftentimes abdominal distress. And so anybody who has sudden onset of those symptoms is having an allergic reaction, which can be life-threatening. And if you don't know what you're allergic to, after going to the emergency room to have this taken care of, I would urge people to go to their doctors, find out what it is that they're allergic to so that they can avoid those triggers and hopefully avoid reactions. Get a prescription for an EpiPen auto-injector and carry that with you at all times so that you'll be prepared to treat yourself should you have an accident and have an exposure to something you're allergic to. And then, importantly, have your friends and families know what you're allergic to as well, so that you don't inadvertently get exposed to something you shouldn't eat when you're at a friend's house.
Yes.
Those are awesome tips. Thank you. And I know they'll save a lot of parents some stress. Now, also, really quick, my last question. Do either of you have advice on how you can help children with severe allergies specifically, because I'm a parenting blogger, help them to feel more secure rather than fearful of their allergy or you know, a possible reaction?
I'm going to give you a short little answer, and then I'm going to pass that on to Joe, who's the parenting expert. But I teach my pediatric patients even down to age 5, how to use an EpiPen. Not that I expect that they're going to have to use it themselves, but if you're at a friend's house and have an allergic reaction, that child may need to either use it himself or talk the mother through how to use it. But my parents also teach their children what they need to avoid. And so they're taught to ask, does this have milk in it? Does this have egg in it? And then the parent can provide snacks that are safe for the child to take to friends' houses or take to school.
Absolutely. I mean, you've hit the nail right on the head there. And I also think it's incredibly important, not just for younger children, but for teenagers as well, to really be able to, own the challenges, the medical issues that they have with anaphylaxis. Know more about it. You can go to 25yearsofepipen.com, where you will just really dispel all those common misconceptions, get the facts, be educated, talk to your teenagers about it, let them understand the importance of being very comfortable and confident in being able to be surrounded by their peers and actually making it very obvious to those around them the symptoms that they have, and be very diligent, if teenagers are getting together and they're in a restaurant, to make sure that you understand what's in the food, that you're asking to speak to maybe the chef, if not the waitress, in understanding, so that you can avoid. It's really important. That's why the 3-step action plan is key. You've got to be able to avoid those triggers and know the signs and symptoms. Carry your 2 EpiPens at all times, and make sure if you have to administer that you follow through with your emergency medical care.
Awesome. Well, thank you, ladies. I know my readers will really appreciate these tips, and I appreciate you guys spreading the word about anaphylaxis and what we can do about it.
Thank you.
Thank you for having us.
Thank you.